Hello, my name is Jason Christopher Arnold, and this is my research proposal for understanding compliance, engaging effectiveness and efficacy with long-acting injectables versus oral medications. Now, as far as the executive summary, mental health medications as well as treatments have always been in the psyche of our civilizations and our history with early strategies and treatments utilizing pathological science and/or scientific discoveries that appear sensational and also produce concepts of wishful thinking as opposed to like treatments that are beneficial for improvement for patients, particularly those suffering from psychiatric illnesses such as schizophrenia. Some of the first breakthroughs within the development of these psychiatric psychotropic medications followed World War II when the introduction of medications to treat schizophrenia, which were antipsychotics and as well as depressants, antidepressants, were used to control symptoms associated with psychosis and specific mental illnesses, as well as to guide patients with new clarity and independence through normal living, as well as developing quality of life outside of a mental health facility. In continuing, the problems, which we'll go into specifically later, arises from efforts of improving the disease course, as well as through uses of medication that prevent decomposition or recurrence of acute illnesses or disease symptoms. So patient adherence and compliance, which is highlighted in studies and RCTs utilizing schizophrenia, they demonstrate that medication non-adherence or lack of adherence to medication is continuing to be a problem, and it causes recidivism, which is a recommitting of index offenses, as well as decompensation, as well as facilitating parameters like relapse, hospital readmission, and loss of progress with any goals that they have achieved within the community or psychosocially. The best solution to choose is to choose clinical trials that best represent the identification of patients who have been hospitalized or admitted with risk of formulations pertaining to relapse. This is going to guide implementation of trials that are going to measure true effectiveness and going to utilize RCTs that range in exclusion criteria, multiple studies, locations, as well as real-world standardizations. Now, quickly as an introduction, these mental health medications have always been in the psyche of our civilizations with these early strategies, again, continuing to be a little bit more whimsical. And we want to make sure that we understand like the earliest forms of treatment while they, again, were wishful thinking and develop into procedures like tryptophanation and bloodletting and purging, where like partial removal of portions of the brain were used with like an auger or a saw or a bore, as well as excessive bleeding and vomiting that corrects like physical imbalances. Those were initial processes and treatments that were used respectively. Also gauging like ineffectiveness and the barbaric nature of these procedures was a consensus to remove anyone that was suffering from mental health illness away from the public or the population because of maybe family stigmas or even feelings of demonic possession with individuals suffering from mental illness. So a lot of times they isolated these individuals and excluded them into the countryside for the duration of their life. Outside of these isolated approaches were induced therapies that put patients in low blood sugar comas, like insulin coma therapy, as well as induced seizure as well as administration of stimulant medication that's going to induce seizures, which is mestrazole therapy, which is actually a precursor to ECT, which is electroconvulsive therapy. And lastly is the process of like lobotomies, where like areas of like the prefrontal cortex or the frontal lobes in the brain were cut and removed, but it often caused impairments in other areas of functionality. So those practices were were relegated to older versions of mental health treatments. And in continuing this, this brought the formulation of after World War II and antihistamines were utilized to isolate certain tissues and things in the brain. Along came long-acting injectables as well as implantable medications, which were utilized to kind of further ease the benefits of medication, as well as reducing the reliability of oral medication. Long-acting injectables, they deliver medication that can be used in intervals of bi-weekly, monthly, every 3 months, every 6 months, and some can even be used every 12 months anyway. The advantage of this are the provisions of knowing that the patient has received the medication, as well as if a patient misses a scheduled injection, that the symptoms are, that are closely related to lack of medication adherence will become easily identifiable from someone like myself, a mental health professional, behavior specialist, or psychologist or psychiatrist, or often a practitioner. Um, Also, that's going to be helpful is uh, the administration of the long-acting injectables that guides absorption of the metabolic issues that plague medication administration because of different blood levels, and also the administration of this oral medication is more subjective and ambiguous because of time constraints of knowing when the patient has hidden medication, and it's also heightened by the fact that pharmacokinetic properties of long-acting injectables really don't affect blood levels as quickly as they would after missing an oral dosage. And so, lastly, these LAIs, they work to reduce tension, family tension that arise from insufficient symptom response, as well as overbearing the utilization of family members, uh, mandating a person utilize or take medication in a standard formulation. Um, Now, the problems arise specifically, we talked about it earlier, but specifically, problems arise from the efforts of improving the disease course, as well as outcomes of mental illness through the use of medication for prevention, or the trials of utilization trials with randomized control trials. They're going to fully demonstrate that the added benefits of utilizing psychotropic medication, they're going to be used to reduce the signs of acute mental illness as well as exasperation. But the underlying challenge is highlighted within the RCTs themselves and the difficulty of improving patient adherence and compliance. Patient adherence and compliance is highlighted by these studies, and they demonstrate that medication non-adherence will continue to be a problem. And it's going to again provide areas through recidivism and recommitting of offenses. So comparative aspects that gauge medication non-adherence, like with objective measures, are often looked at or undervalued by patients and practitioners, which is also going to limit healthcare providers and mental health professionals' ability to, accurately measure medication non-adherence or lack thereof. Continuing, this limitation is going to be compounded by the effectiveness or ineffectiveness of the methodology of simply asking a patient about medication inadherence or non-adherence, as well as having the patient complete a questionnaire or methodologies that measure, ingestion levels, as far as medication and blood levels. They're going to be a little bit costly and intrusive, so you want to think of a better way to understand or gauge medication ineffectiveness as well as a patient's perspective. Also contributing to these problems are going to be medications for prevention of decompensation. The status that many of these patients, especially those suffering from severe mental health illness, they may simply forget to take their medication, or they may have a disease sequelae that is contributed to lack of organizational skills or insight or cognitive impairments that are going to combat functionality. Other problematic areas are going to include mental health stigmas, cost allocations, lack of efficacy in a clinical setting, as well as other adverse effects. As far as my research methodology, I want to utilize a study and a detailed analysis that's going to utilize research methodology through questions of basic research and develop theories within mental health. I want to understand the compliance of patients that are prescribed psychotropic medications through long-acting injections or oral medications. And I want to refine this aspect within the parameters of effectiveness and efficacy. And through my research, I want to conduct a scientific inquiry that's going to involve predictive analysis. And specifically within that analysis, I want to utilize just well-designed research planning, so that for future replication can be utilized, as well as using empirical concepts. It's going to highlight quantitative approach. Um, as well as utilizing statistical and numerical results that they're going to highlight my tested hypothesis that compliance and effectiveness and efficacy neither impact or change long-acting over medications, as well as the alternative hypothesis that long-acting medication will impact or will affect compliance and effectiveness over the utilization of oral medication. So my justifications within the decision will be concluded through deductive reasoning, as well as hypothesis development, observations, and theory development. So again, I am deducing that long-term medications will neither impact or affect are neither impacted or affected by long-acting injections over oral medications, with an alternative hypothesis that they will be affected. As far as data collection, I want to use surveys, and I'm going to focus my measures through observational research. But again, that observational research is going to be in combination with evaluation research mainly. And I'm going to use that to examine systemic effectiveness of these long-acting injectables versus oral medication, as well as cost allocations. And I want to do this to generalize knowledge, and as well as understand design, implementation variance, as well as impact on public health. And I want this knowledge to be conceptualized so that we can understand the limitations and the adverse effects that negate compliance within a mental health facility. Specifically, I want to ask questions that range in the aspects of being, descriptive and normative, as well as gauging impact. And I'm going to gather information that's going to gather data about features and outcomes that are going to be consistent with normative understanding, as well as future research, policy decision making, program implementation, things of that nature. So I want to make sure that I understand and identify whether these results are relevant to the treatment. As well, I want to make sure that this is done retrospectively in an investigative research, and I'm going to look to utilize standards that are going to be used throughout my evaluation research, from utility, feasibility, propriety, as well as accuracy. And this is going to be done to guide decision making and to instill quality measures, as well as increase the strength of credibility. Lastly, my data collection type, I'm going to utilize surveys because it's such a common element, and my utilization is going to be heightened by the conduction of a study design that's prevalent within random sampling, and I want to make sure that I administer these in person through a hot copy, which may vary, but ultimately my main goal is to actively collect appropriate information and accurate information that's going to answer these clinical questionings to the validity of research specific. Just a quick viewpoint of my data collection examples from patient and doctor. I'm going to do a two-pronged survey, one that's identifying the opinions and perceptions of patients, as well as those of doctors. So this is just a quick sample of those questions. And my health project IT plan, I'm going to look to make sure that this is administered appropriately, as well as understanding that these are my references. I have a project launch date that I want to utilize at a tentative date of April 1st, pending IRB approval, and I look to close no later than April 21st. And the duration of the study should not last more than 1 week. And I want to utilize doctors in a mental health facility, as well as patients, and I want to get at least 10 to 15 of each, but more subjects may occur. Thank you for your time, and I welcome any questions, comments, criticisms, or concerns. Thank you so much, and I look forward to presenting these results to you, and adding to the beautiful body of knowledge that we here share with health informatics. Thank you so much, and have a blessed day.